We live in a time when medicines are plentiful and they help us with many health problems. However, they can also silently damage our kidneys. As we get older, our kidneys may not work as well, and it is important to keep them away from too many chemicals and medicines. Unfortunately, aging often brings with it a number of health problems, and we have to take certain medications. However, there are also nephrotoxic substances that directly or indirectly damage the kidneys. These substances can reduce the kidney's ability to filter the blood, leading to a buildup of harmful waste and serious health problems. The severity of kidney damage is measured in stages ranging from mild dysfunction to complete kidney failure. The risk of nephrotoxicity increases as you get older and if you have kidney conditions. There are two main types of kidney damage from medicines: dose-dependent toxicity and intrinsic toxicity. Dose-dependent toxicity means that damage increases with higher doses, whereas intrinsic toxicity is unpredictable and varies greatly between people. Therefore, it may be best to avoid some of these drugs altogether. Nephrotoxic drugs can cause muscle tissue breakdown or rhabdomyolysis, kidney tissue death or nephrosis. Rhabdomyolysis can lead to kidney failure when muscle cells break down and their contents enter the bloodstream, blocking the kidneys. Nephrosis is a condition that causes the kidneys to lose their filtration ability. In addition, some medications can cause inflammation of the kidneys or interstitial nephritis, which can adversely affect kidney function. The kidneys are the vital organs of our body, filtering the blood and removing waste products and excess fluids from the body through urine. When the kidneys are not working properly, toxins can build up in the body, which can have serious effects on overall health. Healthy kidneys help regulate blood pressure, produce red blood cells, and maintain bone health. So, maintaining kidney health is critical to maintaining our overall health. Here are 10 common medications that can damage your kidneys. Painkillers are among the most commonly used medicines to relieve pain and reduce inflammation. In particular, non-steroidal anti-inflammatory drugs NSAIDs are among the most commonly used in this category. With common names such as aspirin, ibuprofen, naproxen sodium, NSAIDs help many people manage pain and inflammation in their daily lives. However, few people are aware of the potential harms of these medicines. NSAIDs usually target pain and inflammation by blocking the production of substances called prostaglandins. This works quite effectively for many people and improves the quality of everyday life. However, there is a danger here. When used long-term and in high doses, NSAIDs are known to damage the kidneys. The kidneys are your body's cleansing facilities. They filter the blood, filter waste, and remove it from the body through urine. To perform these functions, blood flow must be regular and kidney tissue must be healthy. However, NSAIDs can upset this balance. With long-term use, NSAIDs can cause narrowing of the kidney blood vessels and impair kidney function. The ability of the kidneys to filter blood effectively is reduced, resulting in an increased risk of kidney damage. In particular, older adults, those with chronic kidney disease, and those with additional risk factors such as high blood pressure or diabetes may be more sensitive to the effects of NSAIDs on the kidneys. It is therefore important to raise awareness about the responsible use of NSAIDs and the precautions that can be taken to protect kidney health. Healthy kidneys are one of the cornerstones of our overall health. Therefore, the responsible use of potentially harmful medicines such as NSAIDs and taking precautions to protect kidney health is an important issue for everyone. Being informed and making informed choices is a show of respect for the silent heroes of our kidneys. The kidneys filter waste from the body and excrete it through urine. This process is vital to keep the body functioning in a healthy way. However, some antibiotics can have negative effects on the kidneys. In particular, these effects can be more pronounced in people who take high doses of antibiotics on a regular basis. The harmful effects of antibiotics on the kidneys primarily include damage to kidney tissue. This can lead to reduced kidney function and eventually kidney failure. Antibiotics can disrupt the structural integrity of the cells in the kidneys, which can prevent the kidneys from performing their normal functions. The effects of antibiotics on the kidneys may differ between antibiotics. Some antibiotics may cause more kidney toxicity, while others may be less effective. In addition, factors such as a person's general health status, age, gender, and the dose used can also influence these effects. For example, some antibiotics, such as aminoglycosides, can cause severe damage to the kidneys, especially when used for a long time. The use of these types of antibiotics is often seen in hospitalized patients with serious infections. Aminoglycosides are highly effective for killing germs, but their side effects can also be quite serious. Some other antibiotics have less pronounced effects on the kidneys. These antibiotics are usually used to treat milder infections and cause minimal damage to the kidneys. For example, beta-lactam antibiotics such as penicillin usually have low toxic effects on the kidneys. One way to reduce the effects of antibiotics on the kidneys is to ensure proper dosage and duration of treatment. Doctors usually recommend using antibiotics at the lowest effective dose and for the shortest duration. It is also important to check kidney function regularly, especially if long-term antibiotic treatment is required. Nutrition and hydration are also important to support kidney health. Drinking plenty of water encourages the kidneys to work and makes it easier to remove waste from the body. In addition, a balanced diet can also help maintain kidney health. Limiting the consumption of salt, sugar, and processed foods can reduce the burden on the kidneys. Finally, it should be noted that antibiotics can cause harmful effects on the kidneys. Therefore, it is important to use antibiotics with caution and take them as prescribed by the doctor. It is also important to pay attention to nutrition and hydration to maintain kidney health. Controlling blood pressure is a critical step towards a healthy life. However, achieving this control can sometimes have unexpected consequences. Hypertension medications, in particular, not only lower blood pressure but can also have an impact on the kidneys. The kidneys are responsible for maintaining the body's delicate balance. They play a vital role by regulating blood pressure, adjusting fluid and electrolyte balance, and removing toxins and waste. However, high blood pressure can put a serious strain on these organs and cause damage over time. Hypertension medications help lower blood pressure by dilating blood vessels or increasing the removal of fluid and salt from the body. However, these medicines can sometimes cause unwanted side effects. Especially with long-term use, some medicines can reduce blood flow to the kidneys or damage kidney tissue. This can be worrying for patients because it can have serious consequences, such as kidney failure. Therefore, the choice of medicines used to treat hypertension should be made with great care. Dosages should be determined according to the patient's kidney health. However, despite these risks, it is extremely important to control hypertension. Reducing blood pressure to normal levels is critical to preserve kidney function. Therefore, it is vital that patients stay in regular contact with their doctor and have the necessary checkups. It should not be forgotten that keeping blood pressure under control is essential for a healthy life. However, in the process of achieving this control, it is also extremely important that patients take appropriate measures to protect their kidney health. The effects of medications used to control blood pressure on the kidneys should be taken into account. During the treatment of hypertension, patients should take appropriate measures to protect their kidney health. This is a critical step towards a healthy life and should not be neglected. Aspirin is a medication that is widely used today and can help with a wide range of health problems. Originally a compound derived from nature, salicylin has been used since ancient times to relieve pain and fever. However, extracting salicylin from plants and purify it was a time-consuming and laborious process. It was at this point in the late 19th century that German chemist Felix Hoffmann, while working at Bayer, stepped in to solve this problem and invented aspirin. Aspirin can be used for many different purposes. One of its most common uses is as a painkiller, effective in a wide range of conditions from mild headaches to rheumatic disorders. It is also frequently used in the treatment of febrile conditions with its antipyretic properties. However, aspirin's ability to prevent blood clotting also plays a major role in preventing serious problems such as heart attacks and strokes. In particular, people at risk of heart attack can reduce this risk by taking aspirin regularly. This is because aspirin prevents blockage of blood vessels by inhibiting blood clotting. Long-term and high doses of aspirin can cause serious side effects. In particular, gastrointestinal problems such as stomach bleeding and ulcers are common side effects. Aspirin can also have harmful effects on the kidneys and may cause kidney damage in the long term. Concerns about the side effects of aspirin have led researchers to investigate alternative painkillers and blood thinners. These alternatives include paracetamol, ibuprofen, and other nonsteroidal anti-inflammatory drugs. These can offer the benefits of aspirin while reducing the risk of side effects. The balance between the health benefits and risks of aspirin may vary depending on individual health status and characteristics. Therefore, it is important to consult a doctor before taking aspirin or any medication. Aspirin is a very important medication from a medical point of view and can be used for many different health problems. However, it should be used with caution because the side effects can be serious. It is important for everyone to talk to their doctor first to find out about aspirin use. Diabetes is a health problem that affects millions of people worldwide. In this situation, it is vital to keep diabetes under control. However, some of the medicines used to keep it under control can affect kidney function in particular and can cause kidney damage over time. Medicines used to treat diabetes include oral antidiabetics, which help regulate glucose levels, and injected medicines such as insulin. These medicines help prevent complications of diabetes by keeping blood glucose levels within normal ranges. However, in some cases, these medicines can affect kidney function. In particular, many diabetes medicines, such as metformin, can have certain effects on the kidneys. While metformin regulates blood sugar levels, it can also affect the functioning of the kidneys. Long-term use can put pressure on the kidneys and cause kidney damage. Other medicines used to control diabetes can also have effects on the kidneys. For example, some types of insulin can increase the amount of fluid that needs to be excreted through the kidneys, which can put an additional burden on the kidneys. Kidney damage can be a serious complication of diabetes and can progress over time. Therefore, the effects of medications used during diabetes treatment on kidney function should be closely monitored. Doctors usually check kidney function regularly and adjust medication doses. The possible effects of medicines used to control diabetes on the kidneys do not reduce the importance of controlling diabetes. Keeping diabetes under control is vital to prevent possible complications of diabetes. Therefore, careful monitoring of the effects on kidney function during diabetes treatment is important to protect the health of patients. Chemotherapy drugs play a critical role in the fight against cancer. While these powerful drugs target and destroy cancer cells, they can sometimes damage other organs in the body. In particular, the kidneys can be seriously affected by the side effects of these drugs. The kidneys are known as the body's filtering system. But chemotherapy drugs can damage these organs and increase kidney damage through their toxic effects. This is a paradoxical side effect of treatment. While treating cancer, it can cause damage to an important organ such as the kidneys. This requires a complex balancing act for patients. While treatment brings the cancer under control, additional measures must be taken to protect kidney health. Sometimes treatment dosages or combinations of drugs can be adjusted so that the kidneys are less affected, but this balancing of treatment is not easy. Sometimes kidney damage is unavoidable when fighting cancer. Therefore, patients' kidney function should be monitored regularly during treatment and appropriate measures should be taken if necessary. The potential effects of chemotherapy drugs on the kidneys is an important factor to consider during the treatment process. Therefore, it is vital that patients are closely monitored during the treatment process and that the necessary steps are taken to protect kidney health. The evolving face of modern medicine, especially immunosuppressive drugs used after organ transplantation, offers many life-saving treatments. However, these life-saving medicines can sometimes have unexpected side effects. In particular, they can have a negative impact on the kidneys and can cause serious kidney damage. Immunosuppressive drugs are used to suppress the body's immune system. This helps prevent the body from rejecting the new organ after surgical procedures such as organ transplants. However, long-term use of these medicines can have harmful effects in some areas, especially the kidneys. The kidneys are an important organ responsible for cleansing the body and regulating water balance. Immunosuppressive drugs can upset this delicate balance and affect kidney function. Kidney damage can result in serious consequences such as decreased urine production, disturbances in fluid and electrolyte balance, and even kidney failure. This is a major concern for post-transplant patients. The goal of treatment is to find a balanced approach to preserve kidney function while allowing the body to accept the new organ. This usually means careful adjustment of immunosuppressive drugs and regular monitoring of kidney function. But this does not mean that all hope is lost. Continuous advances in medicine may offer new treatment options to reduce the risk of kidney damage. For example, it is possible to develop immunosuppressive drugs with less kidney toxicity or to use additional therapies to prevent kidney damage. Therefore, continued research is needed to understand and treat the effects of immunosuppressive drugs on the kidneys. This could help to improve the quality of life of post-transplant patients and improve their long-term health outcomes. Immunosuppressive drugs play a vital role in vital surgical procedures such as organ transplantation. However, the potential harmful effects of these drugs on the kidneys should not be underestimated. Continuous monitoring, a balanced treatment approach, and scientific research are vital to prevent kidney damage and protect the health of patients after organ transplantation. Sodium bicarbonate is a compound with the chemical formula NaCO3. It is often used as a household cleaning agent or as baking powder in the food processing industry. However, it also has some uses in the medical field. In particular, it is used to relieve heartburn or regulate acid-base balance. However, it has potential side effects that can harm the body when taken in high doses. The effect of sodium bicarbonate in relieving heartburn is based on its ability to neutralize digestive fluids with acidic content. In fact, it is one of the oldest and most widely used antacid medicines. Heartburn is caused by the reflux of stomach acid back into the esophagus and can be quite uncomfortable. Sodium bicarbonate can relieve these symptoms by neutralizing this acidic content. However, prolonged and high-dose use can cause the stomach contents to become more alkaline than normal and impair digestive processes. Furthermore, sodium bicarbonate has the ability to regulate acid-base balance. The acid-base balance in the body is regulated depending on the pH level in the blood. Sodium bicarbonate can affect the acid-base balance by raising or alkalizing the blood pH. However, this needs to be done in a controlled manner. Otherwise, an increase in blood pH to undesirable levels can lead to serious health problems. High doses of sodium bicarbonate can, however, negatively affect kidney function. The kidneys filter excess sodium from the body and excrete it through urine. However, when large amounts of sodium bicarbonate are ingested, the kidney's ability to manage this process can be challenged. This can lead to decreased kidney function and even an increased risk of kidney stone formation. Other possible side effects associated with the use of sodium bicarbonate may include gas, bloating, vomiting, headaches, muscle weakness, and even heart rhythm disturbances. Therefore, the use of sodium bicarbonate for medicinal purposes should be carefully supervised. Sodium bicarbonate may have some benefits, such as relieving heartburn or regulating acid-base balance. However, high doses and long-term use can lead to serious health problems. Therefore, you should always consult a healthcare professional before using such medicines and follow their instructions. It is also important to be aware of side effects and seek medical advice when necessary. Fluid balance is very important in our lives. Most of our bodies are filled with water, and keeping this water in balance is vital for a healthy life. Sometimes, however, our bodies can retain too much fluid, which can lead to various health problems. This is where diuretics come in. Diuretics are medicines that help the body to remove excess fluid and salt. This can be very useful, especially in cases such as edema. However, like any medicine, diuretics should be used with caution. Long-term use, especially if uncontrolled, can put excessive stress on the kidneys and negatively affect kidney function. So, how do diuretics work? Interestingly, many of them work by acting on the kidneys. Our kidneys are an incredibly complex system for controlling water and electrolyte balance in the body. Diuretics increase this function of the kidneys, causing them to produce more urine. This helps to remove excess water from the body and reduce conditions such as edema. But it is important to remember that diuretics are not limited to removing water from the body. Some can also cause potassium and other important minerals to be removed. This can potentially lead to other health problems. Therefore, when using diuretics, it is necessary to pay attention to a balanced intake of water and minerals. Looking at the history of diuretics, there are interesting findings. Since ancient times, people have used natural diuretics to cleanse the body and deal with problems such as edema. For example, plants such as artichoke leaves and parsley are natural diuretics commonly used in traditional medicine. Even today, these plants are active ingredients in the modern pharmaceutical industry. However, the discovery and development of modern diuretics has revolutionized the medical world. Especially in serious conditions such as heart failure, it may be necessary to effectively remove excess fluid. In such cases, modern diuretics can be life-saving. Another interesting point about the use of diuretics is that they have gained popularity in the world of sports. Some athletes may use diuretics for short periods of time to prepare for competitions or to reduce water retention. However, it should be noted that this use can also be risky. Uncontrolled use of diuretics can lead to serious health problems and can even be fatal. While some anti-inflammatory drugs used over a long period of time and in high doses may initially be effective in reducing inflammation, over time you may experience unexpected side effects. These include serious health risks such as kidney damage. So, why are our kidneys so sensitive? Here are the details. Our kidneys are an important filter system that removes waste from our body. However, some anti-inflammatory drugs can damage these organs. In particular, long-term use or high doses can negatively affect kidney function. This can increase the risk of kidney failure. In fact, some studies have shown that people who regularly use NSAIDs nonsteroidal anti-inflammatory drugs are more likely to experience impaired kidney function. These drugs reduce inflammation by reducing the production of substances called prostaglandins. However, they can also reduce blood flow to the kidneys and damage kidney tissue. It is important to talk to your doctor, especially if you are considering long-term use of NSAIDs for chronic pain. Options such as alternative treatments or lower doses may be considered. Also, drinking plenty of water while taking these medicines can help protect your kidneys. In this video, I talk about an important topic to be aware of when maintaining your health: common medications that can damage your kidneys. Despite advances in health care, unconscious medication use can lead to serious health problems. Knowing about the side effects of the medicines on this list can help you protect your own health. If this information affects your health or the health of your loved ones, please consult a healthcare professional. Healthcare professionals can help you determine the appropriate treatment and precautions. And of course, by subscribing to my channel, you can follow important health information and current health topics. Have a healthy day.